Now we scanning the abdomen to rule out cause of pain. Here we see the left lobe of liver, which appears to be normal and shows normal texture. Now sliding the probe to the lower abdomen. Here we see the abdominal aorta. Here we see the dilatation of left lateral wall of abdominal aorta, and there is turbulent flow in the dilated part of aorta. This is circular shape aneurysm of aorta, in which the aorta is bulges only on one side. Now sliding down the probe. Here we see the bifurcation of aorta into iliac arteries. This aortic aneurysm occurs above the bifurcation of aorta. The dilatation of wall of aorta is greater than the size of aorta. Now how we will write report.